O'clock. Welcome back to Great Days. We welcome to the desk good friend of ours, Dr. Steffany Mohan. It's time to have a great smile. Wouldn't you say? I think it is. What are we talking about today, Dr. Steffany?
We're talking about missing teeth.
Missing teeth?
Yes.
Well, would you misplace them or what?
Well, I mean, you can lose them. You can probably find them again.
So here's why this came up.
Okay.
I went to the doctor's office yesterday. Awesome place. Super nice people. They let me have all the ether I wanted, which was fantastic.
Oh, you never said anything about that.
Did you get the neck wrap?
I got the neck wrap, the warm neck wrap.
What?
Oh, I'm telling you.
Especially this time of year.
A few years back, I had a tooth go bad. I had it crowned, and then after it was crowned, a couple years later, it got bad again. So I just had him yank it out. Well, I'm not a big I'm not like Guy Smiley. When I smile, you can't see it. And I was like, well, who needs it? Well, now I'm finding out that if you let the tooth go for too long, the bone around it recedes, and then that causes more trouble. I'll hand it back to you.
Well, no, no, keep
back
going.
to you, doctor.
You're doing very well. No, but so one of the reasons I wanted to talk about this is because a lot of people don't realize that if you're missing a tooth, then a couple of different things happen. Yes, the bone recedes, so you lose some of the bone in that area around that tooth. So not only can it compromise the bone with the teeth next to it, but it also forces the teeth next to it to take all the load that tooth was taking.
Right.
So when you're chewing, the teeth on either side take all of that force, and so essentially what you do is you start compromising the rest of the teeth, and a lot of times when you're missing a lower tooth, the upper tooth will drift down into that space, and so you'll compromise that tooth as well. So a lot of people just don't, well, it's no big deal, I'm not really missing it, it doesn't bother me, and it probably won't, honestly, and eventually it can cause some problems though. So
Right.
Now, did you have anything there at all, or was it an empty space?
Just the space, yeah.
right, because it's in the back. I mean, a lot of people think, I can't
Well,
see
that's just it. I feel like
I store my gum there.
I feel like when you get to be a certain age and it's in the back, you're just like, eh.
Right, and that's what people think. I mean, they do, and you know what? It's justified that they think that, because ultimately, you're right. You're not going to die.
No.
Yeah, right. But
Well, I mean, someday, but not because
right,
of this,
but
probably.
well, yeah,
Right.
imminently, it's not going to cause death.
Right.
But it can help for long term for you to keep all of your teeth long term, which is really important. So,
Right.
we could get into all that too, where as people get older, their diet changes because they can't chew as much, if they're missing teeth and that kind of thing too. So, I mean, like, personally, I like to be able to chew anything I want.
Right.
I like to be able to smile anytime I want and do that kind of thing. So, and studies have shown that, older people, as they get to a certain point, they get, and Lord knows sometimes we feel like older people, but that decreases their social activity. It decreases their health because of their diet changes. It has a lot of those effects. So
what can be done in his situation?
If the tooth is completely gone, now we're not talking about a bridge or a crown where part of the tooth remains. The tooth is gone.
Well, today in dentistry, the best thing that can be done is implants. And a lot of people perceive implants as, very expensive. I'll just put that one out right there. It can be, but long term, you actually spend less over the lifetime of that tooth or that area, because you don't have to replace, and we were talking about this yesterday, you don't have to, if we did a bridge and we put something that connected to the two teeth next to it and filled in that space with 3 teeth instead of 1, then which doesn't make sense, obviously, with just my hands. But
do it again.
Yeah, I know. So, yeah, right. Yeah, there. Right. Exactly. Thank you. So if you just replace that one tooth with an implant, it has less maintenance and less cost over time, which actually is really helpful. The other thing that the implant does is it acts just like the root of the tooth, and it will hold that bone in place over the life of the implant.
So I'll give it some structure then?
Yeah,
okay.
it does. So when the tooth is missing, you lose that bone.
I've basically got a dent in my jawbone there.
Right.
It's gone away.
Yeah, so when
They're
you
able
put the
to
implant
see that
in
from X-rays.
yeah,
Wow.
when you put the implant in, then it'll preserve that height of bone around.
Now, can it do anything else to your jaw?
Well, that's actually, I don't know if we have the kind of there's a graphic. Yeah, this is really interesting because a lot of people think that as we age over time, we just lose kind of facial structure, and everybody knows
Everything drops.
Well, everybody knows grandma just doesn't have much of a chin anymore or something like that. But it's really about it's losing the tooth and the jawbone structure, and that's what kind of leads to that aging face, you know,
The
or
look.
the look of the aging face. So.
Lou, check your email. I just sent the picture over. And you
Oh,
can
yours?
see.
So,
Okay.
but this is, I think this is a great example because a lot of people think again, and again, justifiably so, that there's no real long-term consequences. But you know, I kind of like my face structure.
Well,
the
that's
way
kind
it
of
is.
huge. If you feel like you're losing that, it could be due to your teeth.
Yeah, exactly. So I mean, you
never
know,
would've
like
thought of
people that they have that appearance where you know they have their face is a little bit smaller, or you know their chin comes forward and their nose comes together, that kind of thing. But we can really help with that just by you know replacing some of that.
So you basically put essentially a screw into the jawbone, for lack of a better
Essentially,
term.
no. That you know what it is. Essentially, it's kind of a high-tech screw because it's titanium, and it actually integrates with the bone. So it fuses with the bone in the jawbone, in the mandible or the maxilla, and it actually holds in there. So the implants are kind of a forever thing, which is why cost-wise it really does make sense over time.
Now, what's
Especially at your age.
Yeah,
At
what's
your
the
what's
young
the price
age.
tag of an implant
Well,
nowadays?
an implant can be, you know, anywhere from like $900 to a couple $1,000s, but there are also pieces and parts that add
Now,
to
how does that differ from a crown? What does a crown cost?
Well, a crown usually goes over the implant. So like when you're missing one tooth, you'll have the implant piece, and then you'll have a connector piece, and then you'll have the crown that goes over
Okay.
it. So we can talk about this a lot more later. I mean, I'd like to kind of continue this conversation because it's really interesting, and people
Definitely
do think,
is.
well, people do think that it's very cost prohibitive, but you know, I mean, just like you know, you finance your furniture, you know, you finance teeth as well.
Yeah.
You know,
and in
a
the
lot of
long
people
run,
do.
you're saving money.
You're way better off, and you know, quality of life stays the same with that. You can eat whatever you want. You can socialize however you want. That's a big thing. You know, people know that as we get older and we lose socialization, that's what actually leads sometimes to aging because people don't get out and they don't do the things that they used to do.
Right.
But putting a big screw or something in your jaw doesn't exactly sound the most exciting thing ever. Can you go right back to work, or
You
does it take
can.
time?
No, you can't. Nope. You have to take a couple days off. Nope.
No, actually, so this is actually the other common misconception that it's going to be very painful because
Right.
it sounds awful, right? So the soft tissue or the gum tissue that covers that space has nerve endings, but the bone actually doesn't have nerve endings.
It doesn't.
So you can actually just numb the soft tissue around that space and not numb, you know, the whole side of your face if you want to. A lot of times we do numb
know
kind of
that.
that. Yeah. So once you place the implant and then you know the soft tissue kind of forms back around it, there's really no pain. I mean, some people walk away and never have pain ever. So,
That's
and
amazing.
most people, if they do have a little bit of discomfort, they'll have it over the first day or two, and then they're fine after that. I mean, I would say 99% of people, they don't have pain after 2 days.
Wow.
So, yeah.
That is
But yes, you're right. You may have to, you know, take a little time.
Couple of days off just to recoup. Yeah.
In your circumstance.
Yes.
you
Right,
might
right.
have.
Which means Friday, and then you're back to work on Monday.
That's
Yeah,
right.
yeah.
All right. So if people want to get more information, because this is, we talk
and
about this all day.
What's
This is really cool.
great is that we do free consultations. You know, so
Yeah.
come in, talk about it. You know, have a little chat about it. We like to talk to people about it because a lot of times they just need more information. And you know, sure, could you go to the internet and get information? Of course, but it's a lot easier to sit down and talk to a human being and get a little more
Get
information.
it in English. Yeah, we can understand
exactly.
it.
Yeah, and we do. We try and talk to people like so they can understand.
And some of the nicest dentists and helpers, dentist assistants you could possibly meet. It's not
thanks.
scary at all.
That is
They're
it.
not evil.
So when's Jackie
nice.
going in for her final tune-up?
I think we're there pretty
Today.
much.
Today, it's today.
Ta-da!
All right, so we'll get the results tomorrow. You'll see
Yes.
those tomorrow here on
Yeah,
there.
she's perfect.
Wonderful. Wonderful. Good to see you again.